yesterday class, we studied regarding drug adverse reaction, and I told you what is drug adverse reaction, how it happened, and now it is type of drug adverse reaction. In slide you can see the 6th type is given here. Type A, that is augmented. One by one we will see all these types in detail with example. So you just write down types of drug adverse reaction. Second, augmented means that is desirable. We know that this type of reaction we will face. And type 2 is bizarre, that is unpredictable adverse reaction. Type C is continuous type. Type D, that is delayed. Type E, that is ending of use, we can say withdrawal symptoms. Type E. And type F is failure of efficacy. These are the type of adverse drug reaction. Now we'll see in detail. Now, adverse drug reaction classification, type A and type B. Difference, augmented and bizarre. Type A is predictable, expected, undesirable effect based on pharmacological properties of drug. It is more common. It is related with dose, mostly preventable and reversible. It's include side effect, secondary effect, toxic effect, consequences of drug withdrawal, etc. These are the augmented or type A type of drug adverse reaction we are facing if we are taking any treatment or any medication, then this type of problem we are facing in that case. Now type B, that is bizarre, unpredictable. Here unexpected, undesirable response we will get based on particularities of patient, depends upon the person to person, differ from person to person. Some persons are sensitive or some persons are resistant for particular drugs. It is less common, non-dose related, and more serious. It requires drug withdrawal. When we will get this type of symptoms, we have to withdraw that particular drug. It includes hypersensitivity. Earlier I told you this hypersensitivity, allergy, and idiosyncrasy. Idiosyncrasy is an excessive or extraordinary response against some drug or some chemical. That is also depends upon the person to person, or undesirable, unpredictable response by the person. Now, type based on onset. This is another type. Acute adverse drug reaction. It occurs within a minute to 60 minutes. Within an hour, you will get all type of reactions that is very lethal or life-threatening. Acute drugs adverse reaction. Second is subacute, it occurs in a 1 to 24 hours in between. You will get all responses, all side effects or adverse drug reaction within a 24 hours. Now, next is latent. That is, you will receive this response within 2 days. Severity of adverse drug reaction. It is divided into a 4 category: minor, moderate, severe, and lethal. Minor, we are getting that thing with any kind of medication we will have or we will receive, or we face some side effect also. That is, no treatment is required. Antidotes, prolongation of hospitalization. If you are hospitalized for long time, then this type of things occur. Moderate, require treatment in moderate adverse deviation. You have to take some treatment or to avoid the allergic reaction what you are getting after taking the medication. Change in treatment, you have to change your previous treatment or change the medicine that is not suited to you, and here you have to stay in a hospital at least 1 day or more. Now, severe adverse drug reaction, you have to take intensive treatment. It is life threatening and it will give permanent damage. Adverse drug reaction is very dangerous if it occur in a severe or lethal form. Minor and moderate we can manage by the treatment, but severe you have to take lot of precautions. In lethal, directly, indirectly contributes to the death of the patient. So these this is the severity of adverse reaction. You can see here. Now, FDA defines serious adverse drug reaction as which result in death, life threatening. If you have pen and paper, please note down. Result in death, life threatening adverse drug reaction, requires hospitalization, prolonged hospitalization, cause disability, cause congenital anomalies. Congenital anomalies means the abnormalities in fetus or during the birth or after the birth. Abnormalities occur in a newborn baby, require intervention to prevent permanent injury. These are the guidelines that defines serious adverse drug reaction by FDA. Now, type A reaction or augmented. That is, I earlier told you classification of adverse drug reaction. That is 6 type, and number 1, type A. Type A adverse drug reaction is augmented. It is pharmacological properties of drug, extension effect here, that is predictable dose related responses, uh, that is well known side effects, prevention and adjustment of doses regimen, or your prescription. Example, benzodiazepine, it causes sedation. Furosemide, it causes water and electrolyte imbalance. That is, furosemide is diuretic drug and it increases the flow of urine, so it causes electrolyte imbalance. Similarly, heparin and warfarin, they are anticoagulant drug and they cause bleeding. And also insulin, insulin sometimes it cause hypoglycemia and that is a adverse drug reaction type. And also you can include in this H1 antagonist drug, that is anti-allergic drug, which cause also sedation, that is very common side effect or adverse reaction. Now adverse effect, the predictable dose dependent reaction unrelated to the goal of therapy, often produced by the same drug receptor interaction, responsible for the therapeutic effect, differing only in the tissue organ affected. Some example, just write down this. Some example of adverse effect, that is a drug which is important for life saving, but they are having adverse effect also. Uh, like isoniazid, rifampicin, pyrazinamide. These three combination we are taking in the case of tuberculosis, and this is a first line agent of tuberculosis. Without this, treatment of tuberculosis is very difficult, and these three combination is cause hepatotoxicity. It damage liver severely. Similarly, one more anti-tubercular drug, that is streptomycin. Streptomycin is also anti-tubercular drug and it causes nephrotoxicity and autotoxicity. Nephrotoxicity, it induces renal failure, and autotoxicity also affect the ear problem or deafness. Captopril, it causes cough. That is, captopril is antihypertensive drug. There is simvastatin and nitrates, propranolol, and tetracycline. These are also drugs which cause the adverse effect along with their use. Now, type B reaction, that is bizarre. I told you here you are getting unpredictable responses. In first type A, you are getting the responses, predictable responses, that is related with pharmacological activity of drug. Now here in picture, this cartoon, you can see this unpredictable response received by the patient and number of uh, tumors, you can say, or found in his skin, like that abnormal response patient getting in the type 2 drug adverse reaction. Abnormal effect unrelated from the drug's known pharmacological action. Example of bizarre reaction, that is hypersensitivity reaction, Steven Johnson syndrome, and hemolytic anemia. This Steven Johnson syndrome is nothing but a skin disorder or some skin rashes, just like this kid having this skin rashes in entire body. This is the picture of Steven. Johnson syndrome. Type C reaction or continuous or long-term effect are usually related to the dose and duration of treatment. If you are taking medication for a long time, in the case of tuberculosis, we are taking the drug for a 1 year or 6 month continuous taking same drug in high dose, that also affect the that also induce the adverse drug reaction. Uh, Here example is given ethambutol. Ethambutol is an anti-tubercular, well-known anti-tubercular drug that is first line agent, and it cause retinopathy. Retinopathy means permanent damage in vision. And NSAID, these are the non-steroidal anti-inflammatory drugs. If we are taking for long time, it cause nephrotoxicity or renal failure. Now, type D reaction, or it is called as delayed reaction. It cause when taking the medication, it cause the effect on the fetus or newborn baby through the mother or parents. It cause carcinogenesis or teratogenesis, and thalidomide is an example that is a big tragedy in Second World War. You well known this thing. Uh, Baby born with no hand and legs, without hand and legs. Thalidomide effect. Now, type E reaction, that is ending of use. It is also known as, earlier I told you in the beginning of this lecture, that is withdrawal syndromes or withdrawal of treatment of any drug. Here you can see number of drugs or habit forming drugs, they cause this adverse reaction. Example, just note down, this example is important when you are writing the answer, or here you are giving the answer of multiple choice question. You must know which example is belong to which category. So benzodiazepine, it withdrawal of benzodiazepine use, it induce insomnia. These means you don't get sleep without the medicine. Clonidine, it rebound hypertension. Clonidine is a good antihypertensive drug. Whenever you withdraw this drug, it cause the hypertension or again a reoccurrence of hypertension. Similarly, corticosteroids, acute adrenal insufficiency. Adrenal gland secretion uh, decreases by the removal of corticosteroids medication. That is type E adverse drug reaction. Now, type F reaction or failure of efficacy is counterfeit medicine. Counterfeit medicine are the medicine, they are claiming the pharmacological response, but they don't have any pharmacological response, or just like fake medicine or duplicate medicine, like we can see. They are assuring the content of that particular drug, but it is not present in that dosage form. Underdosing medication means here drug is claiming 500 mg tablet, but actually only 50 100 or 100 mg medicament is present in that particular drug. Here also you will not get proper drug response. And third is drug interaction, That is also a cause of type F adverse drug reaction. Drug interaction, just you can see here, warfarin, which is highly protein bound, is displaced by valproic acid, leading bleeding. Means if you are taking warfarin with valproic acid, then it may cause bleeding in your body, because the warfarin uh, uh, didn't bind with protein, and continuous it gives its effect, and it causes the bleeding, because warfarin is an anticoagulant drug. Similarly, aspirin inhibit platelet aggregation together with heparin, and anticoagulant leads increase the risk of bleeding. So in the case of heparin and aspirin taking together, the drug interaction which lead or increase the risk of bleeding. So we avoid the aspirin along with anticoagulant. Now, adverse drug effect may be categorized into number one, side effect, that is undesirable effect at therapeutic dose. Here you can write down the example: atropine, pre-anesthetic drug medication, and undesirable effect is dryness of mouth. Codeine, it is used, or desirable effect is suppressed cough, but undesirable effect is causing constipation. Codeine also is a very habit forming drug, and nowadays we are not using as a cough suppressant, codeine as a cough suppressant in our cough syrup and cough related preparation. Now, making use of side
उसको
effect.
पता नहीं क्या हो गया, इतना सारा भरा है, चल अचानक से बंद हो गया।
Any question? Rupal? Making use of side effect, minoxidil, that is antihypertensive, and hypertrichosis is occur in, that is very common. Minoxidil is antihypertensive drug, but hypertrichosis, it increase the hair growth entire the body. That is a side effect. And codeine used in uh, codeine used by travelers in to avoid the diarrhea condition, because its side effect is constipation. And this side effect we are using as a effect of drug. Minoxidil, we can give the uh, patient who is suffering from baldness. They are not having hair growth. Then its side effect is hypertrichosis. Trichosis. Hypertrichosis is uh, increase the hair growth in an entire body, and this minoxidil side effect we can use to give the treatment of male pattern baldness first. Similarly, codeine having side effect constipation, but we can use this side effect to give travelers uh, this to avoid the diarrhea. Now, secondary effect. Second is indirect consequence of primary action of drug. Example, corticosteroid. If we are giving continuous corticosteroid or taking the medication of corticosteroids, our immunity become a decrease, or It cause a chances of tuberculosis. And similarly, second drug is tetracycline. It decreases the bacterial flora and it cause also a super infection. Now, third is toxic effect. Here, accelerated form of side effect due to overdose or prolonged use. Here, example, high dose of heparin cause bleeding and prolonged use of streptomycin cause autotoxicity or nephrotoxicity. That is toxic effect of drug adverse reaction, adverse drug reaction. Now, fourth is hypersensitivity and allergy condition. Here, immunological mediated allergy response occur when sensitized individuals are re-exposed to the same drug again. Now, humoral type 1, type 2nd, and type 3rd, or cell mediated type, that is type 4. These are the hypersensitivity or allergic reaction due to the medicament or extraordinary response to a particular drug. Now it is again classified anaphylactic reaction due to IgE immunoglobulins antibodies. It occurs, anaphylactic response occur within a minute to 2 to 3 hours. This is a type of allergic response. And type 2, this is cytolytic reaction due to antigen antibody complex within 72 hours. This reaction we can see in hemolytic anemia and SLE. SLE is systemic lupus erythematosus, that is a type of skin rashes entire body and face of the patient. That redness, it induce redness in a body. Now type 3 is retarded to Arthur's reaction. Here, immune complex mediated reaction. It occurs in 72 hours to 1 to 2 weeks. Example is serum sickness, Steven Johnson syndrome. PAN is another example of this. Procainamide. Procainamide induced systemic lupus erythematosus, that earlier I told you, SLE. And type 4 is for delayed hypersensitivity reaction, that is contact dermatitis. These are the allergic reactions. Now fifth is idiosyncrasy. In beginning of lecture I told you this idiosyncrasy, that is extra response of some chemical uh, genetically determined abnormal reactivity to a chemical. Here, drug interact with some unique features of individuals not found in majority of subjects produced by uncharacteristic reaction. That only few persons they are sensitive for that particular drugs or medicine for this idiosyncrasy adverse drug reaction. Examples are barbiturate excitement and mental confusion in some patients, not all patients, but in some patients, this you can see. Similarly, bromfenicol is a good antibiotic, broad spectrum antibiotic, but aplastic anemia in some patients. And quinine and quinidine, cramps, diarrhea, purpura, asthma, and vascular collapse occur in some patients. That is in idiosyncrasy or hypersensitivity of uh, some chemical to some pupil, not for all. Now, this is drug intolerance, that is also at adverse drug reaction. It characteristic toxic effect at therapeutic dose. Here, therapeutic dose produces toxic effect in some individual, not for all, for some individual. At that condition, we have to take care, or we must know the history of that patient, then only we prescribe the drug. Converse of tolerance, sensitivity to low dose, these are the reasons in drug intolerance. Example, single dose triflupromazine, that is called muscular dystonia or muscular failure. These are drug intolerance. Now, some adverse drug reaction. We have less time in today's class. Only 3 or 4 minutes are remaining. Just note down. This photosensitivity also cause adverse drug reaction, also cause photosensitivity or phototoxicity. Cutaneous reaction, sensitized skin, and ultraviolet radiation also cause this. This is a two type, phototoxicity and photoallergicity. This phototoxicity, you can see in next slide. Phototoxicity, drug metabolite accumulate in a skin, absorb light, photochemical reaction, photobiological reaction, local tissue damage, that is erythema, edema, blistering, and hyperpigmentation. This occur in a short wavelength, that is ultraviolet region, 290 nanometer to 320 nanometer. More common, it is occur when we are giving tetracycline. And photoallergic, this drug and metabolite cell mediate immune response, UV light, pop, pop, popular and eczematous contact dermatitis like given in picture. Next slide. Longer wavelength, it occur in longer wavelength, that is 320 to 400 nanometer. That is also in a ultraviolet wavelength region, and this type of allergy is occur when patient is treating with sulfonamide and griseofulvin. Sulfonamide is common antibacterial drug. Griseofulvin is antifungal drug that we are using, and tetracycline is most common broad spectrum antibiotic. Now, next is drug withdrawal reaction. Sudden interruption of drug worsens clinical condition of which previously drug was used. It uh, cause a withdrawal effect of particular drug, and uh, patient become a more worse condition as earlier as he was taking the medication. An example is uh, corticosteroids in asthma. It precipitate and withdrawal of corticosteroid. It precipitate acute attack of asthma, depression, myalgia. These all are the related with respiratory failure. Second is beta blocker, that is also cause worse condition of angina and precipitates myocardial infarction.